So I'm just going to go slightly off topic, so I apologize, and I'm going to use some of my uveitis cases also to explain how the effect of the wide field imaging and some of the OCTA can really change your practice. And you can use the same principles, of course, in the vascular diseases. So ultra-wide field imaging has come a long way, and originally started with the Optos system, but now we use the Heidelberg as well, and Zeiss has a good system as well. And of course, several companies have the OCT angiography as well. And it really changed how we looked at things with the ultra-wide field. You can see that the slit lamp beam and the standard photographs only show us a limited amount in the fundus, but with the Optos system, which sort of has been around now for just under 8 years, you can see right out to the far periphery in the retina. So the applications of the ultra-wide field imaging are wide. There's vitreous haze, it's in the photography, in the fluorescein angiography and ICG and autofluorescence. So I know we're mainly talking about vascular diseases here, but these applications are all important and can be used in all the diseases. So just using some examples from the uveitis field, you see the vitreous haze can also be assessed using the ultra-wide field imaging. And for example, I had this lady with the toxoplasmosis, and you can see that she had an old toxo and then end up with a new scar, a reactivation, and it kept on spreading in spite of treatment, and there was a lot of vitritis, and it was very difficult. We couldn't see anything in the fundus with either the indirect or on the slit lamp, but using the wide field imaging through the Optos, because of it doesn't use white light, it can penetrate through the vitreous haze, and you can see the far periphery. And sometimes this is useful when you've had vitreous hemorrhage in diabetes or in other vascular diseases. And this is, so she's not had a vitrectomy for all the VR surgeons here. This is purely on medical treatment. The vitreous haze cleared up. Monitoring patients also, again, this can be used in any patients with, so this normal looking fundus with lady with chicken pox presented with this whitening in the far periphery, and it's very easy to monitor the patient week by week, and you can see that they have the progression was halted with treatment. So fluorescein angiography has really been very important in all these vascular diseases, whether it's diabetes, whether it's vein occlusions, or uveitis. We know that conventional angiograms only show us the central field, but with the ultra-wide field, you can get to the real far periphery. So if this patient had conventional angiography, you would see that the central retina looks normal, the disc looks normal, the vasculature looks pretty normal right throughout, except in that far temporal periphery where you can see there's some leakage, and there's also occlusive disease there. So, and this in the diabetics also we see in the far periphery, you may find areas of non-perfusion, which then can lead to either increased VEGF levels and then even macular edema. Similarly, these patients can be more. So again, you can see this peripheral disease, which is causing cystoid macular edema in this patient, and that would not have been picked up perhaps with conventional angiography. Large areas of occlusion seen in this patient, where you can see that that there's been occlusive vascular disease, and you can see these in vein occlusions. So this is a patient who had a vein occlusion secondary to lupus, and ended up with the angiogram showing that the non-perfusion in the far periphery. So things that we would not have picked up earlier on conventional angiogram. And there are several of these cases. This patient also, you can see, again, right in the temporal far periphery, there's an area of occlusion and fibrosis there. This patient, again, you can see that you can see the ghost vessels in the periphery on the fluorescein angiogram, where there is no perfusion, and now this may not have been picked up on the conventional fluorescein angiogram, but the wide field has really made a huge difference here. And you can even quantify the amount of leakage, and so there's several places are now looking at softwares which quantify the leakage. Now this is the green signifies the amount of leakage before in picture A and after treatment in picture B. So you can then use quantitative markers to know how effective your treatment is. So, the ultra-wide field angiography has been a huge development and has really changed the way we look at the periphery in all vascular diseases, whether they're linked to inflammation or diabetes or vein occlusions. Other applications of the ultra-wide field imaging that has made a difference to our practice is autofluorescence. This is a patient with age-related macular degeneration, and you can see that there's loss of autofluorescence quite not just in the macula, but actually a lot more in the peripheral retina. And so this is macular degeneration actually is age-related retinal degeneration. This is a young boy, age 4 years old, who was diagnosed with a uveitis and sent to me. But when you look at the autofluorescence, you can see that there's lots of hyper and hypoautofluorescence, and then there's a ring of hyperautofluorescence around the macula. And the area of schisis in the retina does not look like inflammatory. It doesn't look like intraretinal fluid or subretinal fluid. And I said that this patient doesn't have uveitis, and in fact this is an inherited retinal disease. So we did genetic testing and confirmed that this was an NRL mutation which causes retinoschisis. So it also, the autofluorescence helps us make decisions. You can see that this patient had a lot of hypoautofluorescent lesions. They did not accept treatment. Of course, 3 months later, they came with new lesions, and then I could convince them that, look, you're developing new lesions. And again, these are all in the far periphery, and so this would not have been possible if it wasn't for the ultra-wide field imaging system. And it is easy to convince the patients then afterwards, and also the monitoring of these patients. OCT angiography. I have to confess that we don't have a OCT angiography machine in our clinic full-time, so we've had a few on loan. But it uses the laser light reflectance of the blood vessels, so it depends on the flow of the blood vessels to delineate these blood vessels. So any vascular disease, whether it's diabetes or vein occlusions or uveitis, where the blood flow is affected, will have pathological changes in the OCT angiography. The other big change with OCT angiography is that it can differentiate between the layers, between the superficial and the deep retinal layers. And you can see this patient with the diabetic retinopathy, and very clearly delineated. You can see on OCT angiography the new vessels. The pattern of the new vessels is very obvious. You don't need to see for leakage, and so this can show you quite easily without being invasive. Now, a lot of the diabetic patients will have kidney disease and can't have fluorescein injections, or people who are allergic, or just to prevent using the FFA, the fluorescein dye, OCT angiography, not just in the central retina, but you can use that in the peripheral retina also to look for the new vessels as seen in this patient with diabetes. Patients Again, this is the diabetes patient, and you can see that in the center where there is a loss of flow in the OCT, you can see the OCT is thinned, and similarly there is a loss of flow in the OCT angiogram, and you can see that the blood vessel do not show up as easily. And what about in these patients with the uveitis also? You can see with these vascular diseases, and on your left is the normal patient, and in patients with lupus-associated retinal vasculitis, where you have closure of the blood vessels, you can see defects in the flow, and that can also be seen in patients with macular edema. And so the OCT angiogram is very useful in these patients, even to monitor the treatment. This patient with AMPI, also you can see that there's a stasis in the flow, and because there is the OCT angiogram relies on blood flow, you can see that any condition where the flow is impaired, you will get corresponding changes in the OCT angiogram. So we always think of these diseases where you need to have leakage, so you need to have the dye to demonstrate, but actually, as we are seeing, you can see corresponding changes in the OCT angiogram as well. So I look forward to using OCT angiography more and more in my practice. So new imaging modalities are, we are all very, very keen, and we're lucky that we live in this world of technology, that they very quickly establish themselves into the modern retina practice. I think ultra-wide field imaging, whichever system you use, is essential in my practice, and OCT angiography experience is growing, and is going to establish itself in a similar way as we learn more and more on how to use this modality. Thank you.